Thank you. Thanks for having me here. As you see from the title, today I'm not going to talk about a lot of printing, more about systems that I develop, bioelectronics and sensors for advancing healthcare. I'm at Georgia Tech right now. Before jumping into my research, I want to thank my crew members who are really dedicated to research. They are the ones working day and night, making something happen. And since I have fairly big group, as you see, we do multiple team building activities. So go out to the field and do the kick. I don't know whether you ever tried tug of war. That's really fun because like they're so desperate to win the wars. If you see that, we do that because we really value collaboration. So, and also we are trying to have this inclusive culture within our members. And not everyone's perfect, so we borrow everyone's expertise to build new sensors and electronics. So that's why we promote this collaboration, and based on that, we've been successful for getting grants and also, publishing many papers in the domain of biosensors and bioelectronics. Our major research theme is bioelectronics, and under that umbrella, we have three major research pillars. So based on the sensors and electronics that we develop, we are trying to offer continuous portable health monitoring, and also we build systems for advancing automated disease diagnosis and therapeutics. And also based on the system that we have, we are trying to detect users' intentions for persistent human-machine interfaces. Obviously, I don't have a lot of time today, so I'm not gonna go all the details. So if you are interested in my research, please stop by my website and read the papers. Also, you can email me about questions later on too. But this is our recent outcome, the summary of our recent research work covering sensors and electronics, where we develop membrane sensors based on printing. Again, I'm not gonna tell you everything, but we use a lot of printing tools, starting from screen printing to inkjet, dispensing, and also aerosol. So based on that, we build membrane sensors and also integrated circuits. And based on those systems, we measure signals from the human body, and also recently, we also work with some animals in terms of drug development. That's something that I'm going to be briefly covering today. Our first work that I'm going to share is something that we published in 2019. The reason why I'm sharing this with you is that this is the first paper that we developed our integrated electronics, and we use that system for cardiac patients. So based on collaboration with Emory Cardiology, we study the interface between our sensors and electronics with the human skin, and we came up with an idea to have gel-free dry nanomembrane electrode that can have great contact. And based on that materials and mechanics study, we found a way to control motions. So what you can really do is that you can have continuous monitoring of those cardiac signals when somebody is going out there to the daily activities, not just staying in hospital. So based on printing technologies, again, we built a system that has multi-layered structures. As you see that we start from membrane sensor electrodes, and then we print other layers by using dielectric materials and also conductive materials. And then at the end of the day, we integrated functional chip component to give certain functions. So here in this case, it has a ceramic antenna, a Bluetooth microcontroller for wireless data communication with an external receiver. That's the first work. And then starting from that electrical sensing, we also found a way to integrate other sensors like microphone. So here in this case, we integrated MEMS microphone, again, on the stacked structures, and then we encapsulate everything together to make this type of stethoscope. It's different from conventional stethoscope in a way that this guy can be mounted on the skin for continuous sound detection. So it's a digital stethoscope. And based on location, as you see that once it's mounted on the chest, we can measure cardiac sound. And once it's mounted on the backside, then we can measure pulmonary. And again, based on collaboration with our partners at Emory and Children's Healthcare of Atlanta,